Hello guys, welcome back to the Book of Perfusion by Jasitai.
Welcome back to the book of Perfusion by Jasitai. मेरी आदत है मैं repeat करता हूँ.
Okay. So here we are again with the new podcast with new topic. So today our topic is coronary artery bypass grafting. Oh, sorry, not the coronary artery bypass grafting. It's the coronary artery disease.
So we will try to understand what is the coronary
because we are the perfusionists, we need to do the CABG, coronary artery bypass grafting. So we should know that what is the artery disease, what's the actual causes to go for the bypass.
Bypass surgery. So today, first of all, we need to understand what is coronary artery disease, or we can say what is cardiac heart. So not congenital, cardiac heart disease, coronary artery disease, cardiac heart disease, or we can disease.
Okay.
So if you talk about the coronary artery disease, so coronary artery disease is actually the abnormality of the coronary. So when your coronaries get inflamed, or you said there is the coronary artery becoming the coronary get a damage,
okay,
or the coronary artery get inflamed, or it's damaged due to the high blood cholesterol level, and which deposit the coronary inner line of the coronary get deposit with the fatty acids, or we can say the lipids.
Okay.
So usually patient get a hyperlipidemia, which can cause which is causing to the narrowing of your blood vessels. And your blood vessels mean coronary vessels.
Okay.
So coronary vessels get a plaque there,
okay,
or we say atheroma there, so deposit there, and which get compromising of the blood supply to the myocardium.
Okay.
So actually this is called coronary artery disease, or we can call the coronary artery disease, or we can say atherosclerosis. So atheroma. So why the atheroma happen in the coronaries is because when your the inner surface of your mean endothelium of the artery, or you can say the tunica intima of the artery get inflamed, and you start, then there is a immune system activated, and then all the blood cells and the WBCs start moving to repair, to heal the coronary artery from inner part of it, and it start making a plaque there because of the damage of this artery. So when the immune system activated, so the WBCs and platelets start activating on the intima of the artery to repair, to heal, because your artery get damaged or you get inflamed, and which cause the narrowing of the blood supply vessels, and then you are going to compromising the myocardium blood supply, which lead myocardial infarctions, or you get angina because of the compromising the blood supply due to the atheroma, or due to the plaque in the coronary artery. So hope it is clear. This is the coronary artery disease, or you can say this is cardiac heart disease, or this people you say the atherosclerosis, or atherosclerosis, or atherosclerosis of the.
So the major reason is the coronary artery disease. It can be due to the plaque or some atherosclerosis.
It is because of the major reasons can be the one of your hyperlipidemia, which cause the more fatty deposits in the inner part of the artery to deposit and start more due to when we started the fatty start depositing in the inner part of the artery. So sometime it get plaque get broken. Once it start broken, that make a more disaster. So once it get broken inside the
platelets will come and start.
Then platelets and the WBC is activated to repair that part. So once you start repairing with the platelets and with the WBC, so that will create a more plaque there, and then the vessels get first it started 30% occlusion, then it start 30%, 40, 50, sometimes 100%. So this is the causes of.
So any layperson can get any person who is suffering from heart disease can get triple vessels disease or
two vessels, single vessel. So that is another chapter. So this is actually the coronary artery disease, the reason. So main reason is your coronary artery get damaged,
Okay.
or it'll get inflamed, or get dissections, or it is because of your hyperlipidemia, and there is different causes we're going to discuss. Okay. Hope it is clear. And then we're going to talk about the causes of the risk cause factor of the coronary artery disease. It is modifiable or non-modifiable.
Okay.
So modifiable risk can be modified, mean which you can change by your activity.
Okay.
Or by reduction of your the work you are doing.
By medications.
For example, hypertension.
Okay.
So hypertension can be controlled with the medication.
Even with the lifestyle also.
With the lifestyle.
Yeah.
So number two, we can say like you started to smoke cigarette smoking, so which lead the coronary artery disease. It can be the reason. This is modifiable. So you can stop smoking. So hypertension we already discussed, and then diabetic mellitus.
Yeah.
So diabetic can be controlled with the medication and even the lifestyle. Nutritionist. So you have to take care of taking the food or the meal during your daily routines.
Okay.
And then there will be like a physical exercises. So people used to do that. You have to spend like a 30-40 minutes for exercise, walking, running, and it will also prevent from the coronary artery disease. Mostly nowadays we have too much stress. So stress can also cause more heart disease. Heart disease can be the stress, diabetic mellitus, hypertension, and lifestyle, and obesity, the fat. People are just sitting, lying, eating, and doing nothing. So by sitting, lying, and eating, more fats can cause your obese. Okay. So obese patient have the congenital why I'm telling it, the coronary artery disease. Okay. What is non-modifiable? So non-modifiable can be your family history. That your forefather, your parents have the heart disease patient, so there is a chance
so
you will get also
prone to the
you have more chances to be a heart patient. Then gender. Mostly the males have the more yes, you get there is a chance
because they get more stress.
More
work stress,
yes.
Family stress.
And third is your third can be the what will go to increasing of your age. Elder people have
more chances
as compared, because elder people have
their heart muscles are already
weakened. So when you get, and then immune suppressive patients, the patient will having the immune compromised patients having the chance of more coronary artery disease. So this is modifiable, and non-modifiable. This is the causes of the coronary artery disease. Pathology of the coronaries disease. So what is happening in the etiology factors can be due to the number one is the injury, inflammation of the endothelial cell of the artery.
The same thing already
as we discussed. So first your endothelial cell get damaged, due to inflammation, so any reasons. Okay. Then the cause of once you get your endothelial get damaged or inflamed, so your immune system reacted. Once the immune system reacted, so they start accumulation of the lipids. So they start lipids accumulation, start lipids, and platelets and other, as I mentioned, clotting factors start repairing that place, which cause more atheroma or plaque there. Okay. So once it start making the atheroma or plaque more, so it will increase
as much.
So it will going to compromising the blood flow, and which is going to lead to the coronary artery disease, and you are not able to perfuse the heart muscle, the myocardium is going to compromise, and which can going to be lead coronary compromising of the oxygenation and the blood supply, and which going to be lead myocardial infarction.
So we can treat the coronary artery disease sometimes with the medications if the percentage is
See,
very
now
low.
too, I already mentioned two things. One is modifiable and one is non-modifiable.
Non-modified.
So modifiable disease is like you have to monitor your blood pressure on a regular basis. Start doing exercise at least 30 minutes a day. And number 3, there is if you are a chain smoker, you have to reduce or you have to stop your cigarettes. Number 3, without any reason, don't take a stress. Don't take a stress. So this is in your hand.
Yeah, there is one syndrome, broken heart syndrome. If you grieve more or you feel more sorrow, your heart muscle will be weakened. So it can
exactly. So try to spend happy life.
Yeah.
And be more happy. My message is always stay with the positive people.
Yeah.
As much you are staying with the negative people, you will get in trouble. Okay. So at the last, the message is focused on modifiable factors. And if you like this movie, like this video,
podcast, please like, share. Hope you understand the coronary artery disease.
Because as a professional, you should know why there is a coronary artery disease.
Yeah.
So
we will meet you again with the new topic, new vlog. And if you like this podcast, please like, share, comment, and press the bell icon so you can get new updates for our videos.
Have a nice and good day. Bye bye.